in every 6 Belizeans is living with diabetes. Diabetic cases have been on the rise globally, spurring an increased effort to get people to live healthier and prevent diabetes, and for diabetics to maintain a healthy lifestyle in order to prevent complications.
I came to find out I have diabetes when I was at home. I was eating, it was my birthday. Then like on the other day when I woke up, I start feeling bad. Like as I eat my breakfast, I start throwing up. So after I went to the health center, and the nurse asked me about who is my father, because she know my father got diabetes too. And then she called the ambulance and hooked up an IV on me, and I went to the doctor.
Clyde Lewis was 17 years old when he was first diagnosed with diabetes. Even though his father's a diabetic, his immediate fears were on the worst possible scenario.
I hope I didn't know.
Why?
Because my cousin, he made that fight too. But because he made it on dialysis.
53-year-old Joel Torres also had a family history of diabetes, and being well aware of the symptoms, he decided to get tested.
My mother was actually a diabetic. My brother died of diabetes already. My mom died of diabetes, with diabetes. And but back then, at that time, my mom was diagnosed, my brother was diagnosed. So just around about when I was 33 years old, I decided to get tested and found out that myself was diabetic. I used to get tired. My foot bottom, or bottom of my feet used to itch. I used to get thirsty a lot and really felt drained by maybe 5, 6 o'clock in the evenings. I would be very drained. And knowing that and knowing my mom's condition, that's when I decided, you know what, it's best that I check with the doctor if this really happened. Acceptance is a thing, like I said. First denial, then acceptance. So your life begins to have a change now because you know, and by having the knowledge of knowing, you could take it twofold. Either you say, okay, I will just drink, eat, sleep, whatever, and continue before I knew, or I'm gonna say, I'm gonna take my meds and I'm gonna do certain things, and it becomes a lifestyle. I watch my brother, self-destructive. Continue lifestyle, no change. Mom, continue lifestyle, change. My brother died, 57. Mother died, 79. I go like, I could make 100. So it was a lifestyle. Education began.
I was more scared of taking the shots.
You don't like needles?
No, you can eat anything. You have to slow down on all the sweet stuff and really, you don't know what, like everyone is pressuring you, you can't eat this, you can't eat that. Just make you feel kind of crazy sometimes.
Clyde admits that being diagnosed in the midst of his teenage years did come with its additional pressures.
Well, for my friends, I see for fun it's sort of. So why? Because someone while they eat and drink, like eat ice cream and drink soft drinks and stuff, and I just try to ignore it. But man, it's a hard challenge. The alcohol, it all depends on how you manage your blood sugar levels. I tell them I'm sick, so I can't drink like that. So now they kind of understand me, but they say, take a little taste. I say, I can't.
For volunteer and diabetic 20-year-old Karen Rayburn, she feels that children and young adults have a more difficult time adjusting to the lifestyle changes. Having been diagnosed at 11, it was a part of her own reality.
And I think it's really easier. It's just that you still learn more with someone and get of age in terms of like maybe 40, 30s or so. You know what you're supposed to do and how you. But I think it's easier because with me, I think it's more challenging because you're as a young lady, you want to go out, you want party and stuff. I don't party, I don't drink and stuff. But it's still challenging because you go anywhere and see people eat certain things, you want it and you can't get it. Especially at school, it's more challenging because you can't say, oh, I'm going to buy vegetable salad. You have to eat what the school have. Maybe they have garnaches, they have different stuff. So you have to eat, even though you eat healthy, eat carrots, but not all the time you have And sometimes financially, not everybody have financially, because they always say diabetes don't have a special diet. You just cut down on the salt and the fat and stuff like that.
Karen, Clyde, and Joel have all become actively involved with the Belize Diabetes Association to help keep themselves informed, but more importantly, to help others, which is one of the main focus of the organization.
The association is a support group for persons living with diabetes. We basically educate persons on the condition and to be a supporter for them. Here at the office, we have monitors, we have kits that we offer at a reasonable prices. We also assist children with type 1 diabetes on their supply on a monthly basis. And for those who can't afford getting a monitor, we work with them that they don't walk away with not having a monitor to do their blood sugar testing.
They had a diabetes walk, and then suggestions came up, why don't we do a diabetes ride, like right across Belize? And so the idea was born. And that's when I even got more involved and begin living even better and doing more exercise, waking up 4 in the morning and putting in some mileage to do that. And while you do that, the meds people get less money from me because meds expensive. And there you find I put it in the bike instead of have to take it the pill.
Since I've been at the Diabetes Association, I've learned a lot how to control and managing diabetes. I'm now open up to say, well, I'm confident enough to say that, well, I'm diabetic, I'm living it for so much years. Open up to people, telling them about diabetes, how diabetes affects you, what kind of symptoms and stuff. So I'm now open up to other people. I could go on the street and say, I'm not diabetic. Yes, I am for so many years. That's something where I used to afraid and to telling people, because it makes you feel like a disease, the way people treat you. But after that, I learned that it's a condition that you develop. They're not like you could go beside somebody and say, okay, I catch it. So that's something we develop.
I start to volunteer because I want to learn more about the sickness, so I can help manage myself and teach others.
For the past 2 weeks, there have been many activities geared at building diabetes awareness, like the health fair hosted by BFLA on Wednesday and another planned by BDA and partners for Friday at the Battlefield Park. You can also participate at the association's monthly meetings.
We encourage persons to come out here at the association to be a member. At the association, we also have our monthly meeting, which is held every third Saturday of the month. This Saturday here, we'll be having the November meeting at KHMH conference room. It's 4 o'clock.
Those people who don't stick to their diets will end up dying from other chronic disease. My advice is just calm down, relax yourself, and do as the doctor said, visit the doctor often.
A lot of you guys out there, and all the guys, when I say guys, I mean girls too, have diabetes. I want to know, need to get tested.
And welcome back. And there we had a story that was aired in or news looking at the people who live with diabetes. We had 3 specific examples there, and their advice, of course, to the general public about knowing their status when it comes to diabetes. Joining us for this conversation this morning, talking about World Health Day 2016, that has a specific theme of Beat Diabetes. We're joined by Robin Daly, nutritionist at the Ministry of Health, and Dr. Jorge Polanco, the non-communicable disease focal point at PAHO WHO. Good morning and welcome.
Good morning.
So let's talk about the celebration of World Health Day and just how significant it is to be able to focus on one health issue at this time of the year.
Well, in reality, it's April 7th, and that is the date when the organization was founded. And over the last decades, it was decided to choose one topic of interest and to highlight it. So you would recall that every year there's a different theme. And the reason is to really use the opportunity, and this is globally. All the countries literally sing from the same sheet.
Yeah.
The commemorate that day, and then governments and the public are sensitized as to the importance and what's the nature, the importance of addressing that specific health problem. In this case, is diabetes, and indeed, I really have no words to really specify the extreme importance of this topic in Belize. Nobody can say I have never seen somebody who does not have diabetes. And the diabetes is, if a person knows diabetes, he knows medicine. Diabetes affects the entire body, all the parts of the body in some way. But the more frightening issue of diabetes is that it is also called a silent disease, in the sense that children or adults could have it and really not be aware that they have already that they are already diabetics. The signs and symptoms at the very beginning perhaps would be absent, or on the medium term they would be so general that if a person is not thinking, or if a healthcare provider is not thinking on diabetes, he or she would not really test for it. However, now globally, the timely testing is a must, especially when you reach a certain age 30, 35. Not only the age, simply because then you have other risk factors that are responsible for diabetes, such as unhealthy food. And to be specific, when I say unhealthy food, is food that have excess carbohydrates, excess fats, that lead to other issues which we will speak on later on this morning in regards to overweight and obesity. So then the nature of diabetes is such that if not detected on a timely manner, it will lead to complications on the short term, medium term, and of course the long term, which we should be able to elaborate during the course of the program this evening. But in reality, that's the bottom line, to in this case for diabetes, to sensitize the entire country that it is urgent to do your timely testing, to detect it in an early manner, and you could live for many, many years with diabetes once you don't get complications.
Now, globally, we're looking at figures where I think it's as many as 1.5 million deaths annually attributed to something related to diabetes. What are the numbers saying in Belize, and are we seeing an increase or not?
Okay. Speaking on behalf of the Ministry of Health, I must be careful in the sense that speaking with the authorities, the numbers are being looked at, and precisely today we have a forum. I cannot really share those figures, those exact figures, because they were being reviewed. But in that forum, I believe the presenter will share those figures. The truth is that diabetes over the last recent years has been being looked and has been redefined in regards to its values. I'm not really sure where the ministry is right now in specifying what values that would be, because depending on the glucose blood values, that would determine if a person is diabetes or not.
Yeah.
But the tendency globally is to reduce that maximum value, to reduce it a little, which means that that it would increase the number of diabetes. The good thing about that is that that will allow for a more timely and opportune diagnosis.
Yeah. Well, what we do know is that diabetes-related death has been one of the leading causes of death in Belize for quite some time. I'm not sure if it's still number one at this time, but it had been for quite some time.
It's the leading cause for NCDs.
NCDs.
Not the leading cause of death. And actually, it's kind of it's running very closely with heart disease. So it's more or less, some years it's number one, other years it's like second, but it's one of the top leading causes of mortality as we look at NCDs.
Now, this of course underscores why we have so frequent conversations about diabetes. We talk to the Kidney Association, the Diabetes Association, we've talked about NCDs, we talked to Ministry of Health representatives, and it keeps on coming up as an issue that needs to be discussed. In this particular forum and in what we're hearing in terms of the message coming out of WHO is to beat diabetes. In fact, diabetes can't be cured. That's the case, right?
That is true.
Manageable.
So we're looking now at preventing people from developing and also having people properly manage.
Correct.
Let's talk about the number of people who develop diabetes, those who, I don't know if you say acquire, but develop type 2 diabetes. Is that the larger number of diabetics that we see?
Yes, the type 2,
Okay.
which once it was called as the adult diabetes.
Okay.
The last official survey, which is getting a little old, but that was the last reported national survey, reported a prevalence of 13.1 or 13.2. 13.2, I think, in adults. I am not sure if that has changed.
Okay.
However, and this is not only in Belize. That figure is very similar to the figures that we are having in the Caribbean and Central America. Some other countries have a bit even higher. But the truth is that apart from type 2 diabetes, we also have the type 1, which traditionally would mostly affect, or has affected mostly children, which is, the cause is a little different. It's mostly related to the production of insulin, versus the type 2, which is related mostly to improper diet.
And going in the, I've often, when you talk about type 1 and type 2, there's also, sometimes you hear people saying that they've been told by the doctor that they're borderline in terms of diabetes. What does that mean? And is there a possibility that once you contract the disease, I don't know what to say, contract the disease or develop the disease, you can only manage it thereafter? What about when you're given that kind of a prognosis, that you're on the cusp? What can you do, and can you do anything?
Yeah, when the word borderline is used, it's simply because the values is, let me use the traditional value, which was 120 milligrams. All right, so anything below 120 was normal. Anything above 120, let us say 122, 123. So it's close to 120. So healthcare providers would say borderline. Now, the definition has changed, whereby anything between 100 and 120 is considered pre-diabetes. Okay, if you would have 105, some healthcare providers would use the term borderline. It's above, but basically what it means is that it's at the very upper limit, and what that means for the person is that that he or she needs to take an active approach in either increasing physical activity to burn excess calories, or looking at the diet to reduce excess fats and excess carbohydrates, because usually the diet should be combined with physical activity. The ideal is to have the two approaches, but if physical activity for some reason is not done, the diet of course is also important to reduce that intake of carbohydrates and fats that are the source of calories. So when we use the word borderline, it means that it's at the very top and that an effort should be made to reduce it. However, a person, if the person is not classified as diabetes, the first option would be, as being diabetic, the first option would be to aggressively treat it with diet, with healthy food.
Yeah.
If there is no response, then the physician would decide on an individual basis if he or she should start with drug therapy.
I also wanted to add, when we try to encourage people not to take too much into the borderline issue, looking at that as you either have diabetes or you don't have diabetes. But also the body's response to bringing down the glucose level becomes a little bit harder. And that's what attention should be placed on, in terms of not only looking at the diet, but looking at really how your body is responding to bringing down glucose levels that stay elevated for long periods of time. Hence, physical activity normally becomes an option as well to start doing, and looking at ways to boosting the way how the body starts breaking down food and reducing sugar levels. Or sometimes the body actually has an issue with how the body makes insulin, which helps to bring down the sugar levels. So sometimes it's something really metabolic that opens their attention, that maybe something is wrong with the system, or actually the eating patterns should change.
Let's address one of the major things we still hear in our society today. And I know, Robin, you've spoken about it before, but it's a great opportunity to look at it. People still directly link excess sugar consumption to diabetes. Oh, you eat too much sugar, that's why you have diabetes. Is that the case?
I would say not really. Yes, excess sugars, but not simple sugars. And what we mean with simple sugars, we're talking about soft drinks, hard candies, sweets. Those have a direct link with putting you more at risk for diabetes, but there are risk factors which lead to overeating, obesity, that plays a very big role with diabetes that people sometimes ignore, and also having overconsumption of one type of food group, which would be the staples. And those are normally when the body breaks down staples, or what people refer to as the carbohydrate group. Yes, it gives the body sugar, it produces sugar in the end, but it's not just overconsumption of direct sugars that would cause you to have diabetes. Just having a poor diet, not exercising, and being obese or overweight puts you at risk for, and of course physical inactivity puts you at risk for getting diabetes. So it's a number of factors that could put you at risk, and not just one in terms of just eating a lot of sweets, because you would hear people say, well, I don't eat soft drinks, don't drink soft drinks, I don't eat much cake, I don't eat much sweets, and I still have it. So sometimes you're predisposed because of genetics, but also there are many lifestyle factors that contribute to developing this disease.
Robin mentioned something extremely important right now, overweight and obesity. And I think that's something that we need to really focus on, and we will during the forum today. Overweight and obesity is well known. It's been documented scientifically that these are factors, that are risks that directly lead to diabetes. It's a known fact, not only to diabetes, but even to certain cancers. And that's a risk that needs to be addressed. So the Pan American Health Organization, along with the Ministry of Health and globally, that has been an approach whereby governments, countries are requested to give much effort, much attention to reduce risks, and overweight and obesity are perhaps the leading ones responsible for diabetes. So then you may not be diabetic, but if you are obese, the risk for you becoming diabetes is very, very high. So then the focus should be on preventing persons, preventing children, young adults, from becoming overweight or obese. And it's not an easy issue, simply because overweight and obesity comes over time. It doesn't come because you want, it comes, as Robin said, because of a traditional poor diet. And that is a problem in Belize, it's a problem in Central America, in the Caribbean, actually globally. So in this report that was launched today, well, in Geneva, it was yesterday, that is one of the issues the Director General of the World Health Organization has made very, very clearly, to address these risk factors with all the efforts that national governments could provide.
That's definitely one of the things we keep on hearing, a shift from disease or condition specific conversation. In other words, we're not just talking cancer anymore. We're not just talking heart disease or just diabetes. We're talking about what you guys have clearly defined as risk factors. Obesity and overweight being one of the major ones, and also lifestyle choices that we have, eating bad and not exercising, not enough rest, and also some of the addictive behaviors that we see, excessive drinking and smoking. When we talk about the move towards intervention in our country, we know that that's part of what has to be done. So I know you have your forum today to address this issue. Let's talk about what's currently in place and what are the future plans for interventions in Belize.
Well, from the Ministry of Health standpoint, which is what I'll be focusing a little bit on today, looking at some of our interventions that we have in place. We have our protocol for the prevention of obesity, diabetes, and hypertension that we use at primary care or clinical level. Those are a specific set of guidelines that would guide the health professional and what should be done when people would come to the clinic or come to a healthcare facility and would be diagnosed with either obesity, diabetes, or hypertension, or sometimes all three. So that has been in place. Also, we have our food guidelines as a prevention. That's a prevention tool, educational tool that we use. We have been always advocating and doing a lot of health education. So our Health Education Community Participation Bureau, HECOPAB, countrywide there is representation in all districts. So the health fairs that we have, the trainings in terms of looking at foot care, looking at prevention of diabetes, these are ongoing interventions that we have.
Yeah.
We also have partnerships with the Ministry of Education when we would do our continuous professional development training or CPD trainings. We work along with them from year to year, looking at addressing health factors, health-related conditions. So training is done with teachers and it's passed on, which furthermore goes into the school system. Also, we have our Non-Communicable Disease, or NCD Commission, which has been formed as well to look at addressing NCDs on a whole from a, I would say, stakeholder point. We have different people that represent that are healthcare professionals, also the private sector that sit on this commission, looking at what can be done from a national standpoint, looking at NCDs. So those are more or less our interventions that we have in place, and it's something ongoing that we need to continuously advocate for and have collaboration, because it's something that's affecting all of us. And then we have organizations, of course, like the Belize Diabetes Association, that's again in most districts, and that does a lot of advocacy and promotion and help with prevention as well in terms of diabetes.
A big part of what we've been talking about is just poor eating habits. But of course, we have to look at what we normally consume within Belize. And some people, we are talking about starches, etc. What we consider a regular Sunday dinner is loaded with starch. And can we get people to look significantly at what we consider a normal meal for us? 1, portions, and just 2, what we put on our plates. To see the reasons for or the need for a change in terms of what we consume. If not necessarily everything, at least some of it, or to add some other things, and to also reduce portions.
That's the challenge that we've been having, because culture plays a big role. Our traditional foods, people won't give them up, and we're not saying to give up your favorite foods, but it's the amount that we have and in relation to physical activity. So that's where we have the problem. So if you're going to be eating a lot of food in terms of 2-3 cups of rice and a big hefty meal, most of the times you will just go and sit down or sleep after that heavy meal. So having that meal, the preparation for that, the amount that we have, what we do in terms of burning off excess calories, this is where we would have some of our challenges in looking at healthy lifestyle changes for people who are at risk for diabetes or people who have diabetes. Because many times people don't want to cut out portions. They want to have food in abundance that they love. And this is where we're having some of the problems in terms of how much do we have? Are we going to be doing physical activity? Are we going to have the same food that we had for lunch? Are we going to repeat that big plate again in the evening? You know, are we just going to have some veg and substitute the potato salad with some veg instead? Just making simple little choices makes a very big difference, and that's many times habitual for people and also culture related. And you know, most of us, culture and how we eat plays a very big role. So that's where we have a lot of our challenges, and that's where the advocacy and the education and the coercion comes in place, because we need to start looking at that if it's affecting us and even our children. There are many children now developing diabetes at a very early age, so we have to have measures in the schools and also not only at healthcare facilities but in our workplaces, looking at how much do we have portions, what are we making our food with, how much of it will we eat, because we can't take it out, but we need to monitor how much we have.
Now, Robin, one of the things as we talk about culture as well, there were some things traditionally that we ate. I think we had a Bishop Martin High School in Orange Walk, did an entire thing on chaya and what it meant, etc.
The health benefits.
The health benefits of it. But we see certain things disappearing also from even within cultures of what we, whether it was kalalu or chaya, we don't see people consuming those. So what do you think contributes to the fact that we may be moving away from certain greens, but picking up other things that aren't healthy for us? And can we have people return, or what would it take to have people return to some of the things? Because chaya was, or kalalu was one of the, are both important things that people used to eat and consume quite a bit.
That's one of our objectives actually for the forum that we're having today, because we need to take a national point, and that's why we're having our stakeholders look at from the different sectors, not only Ministry of Health personnel, but Ministry of Education. We have the Diabetes Association, other stakeholders present to look at what's really the situation in Belize. The discussion was earlier, I think you asked a question about the statistics. We're looking at about 50,000 people more or less estimated in Belize living with this condition, and it's about to rise if we don't take proactive decisions to start to minimize the tendency for this disease to develop. Many people are suffering from diabetes at different levels, and we have to look at it. So the forum actually helps to look at what's the situation and what we can do to address. So food is a very big part of how we manage diabetes and for prevention, not only diabetes, but NCDs on a whole. So bringing back some of those greens, including those in schools, having more educational sessions. We're actually going to be having a nutrition demonstration at this forum, looking at how we can prepare healthy foods. Like you mentioned, in the old days, they used to prepare a lot of greens. They used to have porridge. They used to have things that they do. We don't have that anymore. We're looking at fast foods, things like that for breakfast, for lunch. We're looking at burgers, pizzas, things like that. We're moving away from that traditional home care that we used to prepare the way our grandmother used to make food and bake and that kind of thing. So we have to get back to what can we do as a whole? What can we do as a country, looking at the school sector, the health sector, the business sector, the private sector? What are some interventions we can do? How can we make policies? I think even with discussions with Dr. Palanco, we looked at as a country in looking at taxation as an avenue for soft drinks or whatever it may be. We have to look at making some very big decisions in terms of policy, in terms of advocating for prevention of diseases. Our neighboring countries have taken steps looking at increasing taxes, looking at what they're bringing into the country, the types of foods that are coming into the country, the cost for these foods. I mean, it might be so cheap to pick up a pack of ramen versus buying some vegetables, so availability. So these are all things that we have to be looking at a national standpoint and coming to the table and discussing and coming up with strategies. Really, that's one of our plans, and hopefully our outcomes from this forum is to look at strategies that we can move in that direction to advocate change for a healthier lifestyle.
I'm glad you touched on that, because I really wanted to talk about what are the possibilities of moving into policy changes that will meaningfully, that will be meaningful interventions in terms of what we're eating and the accessibility we have to it. The sugar tax that you talked about, you know, I saw that firsthand when I was in Barbados, and they spoke about being able to recognize that children were consuming so much sugar within the school system and the level of obesity that they were facing, that they felt that there was no other choice for them but to be able to introduce the 10% excise tax for local production and importation. So there are moves being made, and you know, Barbados is the first in the Caribbean to be able to do it. It's happening in other parts of the world, and you know, in Mexico, for example, they have seen the impact of it. Now, we don't typically see those types of actions taking place in Belize. I'll give you the example of the school systems when they talk about having a challenge with just the street vendors that are right in front of they're not in the compound, the schools have no control, they're on the street sides. Is that a direction that we may potentially go in Belize, where the policies that will actually make a meaningful impact, especially when it comes to children, will be implemented?
Well, the main, I would not say the main, but a significant portion of the participants this morning will be principals of primary schools and secondary schools. So I think that goes in line with what you were asking. And the reason why we decided to invite all the principals, we could not really make it national, the interest of time and distance, but we said at least to start with Belize City. So we have invited all the principals of the primary schools and the secondary schools of Belize City, and most of them have confirmed that they will be there. The reason was to really sensitize them as being the persons responsible for the school as to where we are as a country in regards to the prevalence of unhealthy food, obesity, and overweight. So that goes in line. And this fits within a regional strategy where Belize is part of, whereby the region has put on the table over the past 2-3 years at almost every forum, health forum, to look precisely as to ways to review policies and see what can be done to provide an enabling environment that would do two things: that would promote healthy food, as Robin said, and that would reduce the exposure to junk food, as what you also explained. This is something I would say of top priority in the health agendas of the ministers of health of Central America and the Caribbean. And as you rightly said, some countries have already moved in that direction. You would hear at the level of the United Nations, the authorities speaking on looking at taxes. Mexico has a very good experience. I think I shared it at the last discussion here.
They have recorded reductions in purchasing of sugar drinks.
Yes, where in the first quarter last year, January to March, there was a reduction of 8% in drinks that were loaded with sugar. And very interestingly, there was also an increase of 8% of pure water. So then it says a lot. Costa Rica has made it law that the schools, both public and private, cannot sell unhealthy food. It's a law. And well, you have many South American countries that already have it law. The Pan American Health Organization has it on its agenda. It's also part of the regional plans that the Ministry of Health has committed to begin looking at those things. So I believe in the very, very near future, this will come up. And Robin made reference to it. The NCD Commission has been revitalized, to use that term, and it's on their agenda to look at 3 components: policies, clinical management, and preventive care at the level of at the primary level.
Robin, obviously, as a representative of the Ministry of Health, decisions of that nature will take political will to be able to address them. And oftentimes when you're up against the private sector, it becomes very difficult to be able to do that. How much do you find, how committed is the NCD Commission, those at the Ministry of Health, in terms of really being able to make interventions that will be meaningful for children and adults in our society?
The Ministry of Health is very enthused and very much on board in terms of looking at this, because it's very expensive managing and looking at controlling diabetes from a primary care standpoint, medication, drug use, hospitalization. 1 in every 3 people that come that gets admitted to the hospital has an NCD or gets admitted due to an NCD. So, and even though the system is there to deal with this, we want to minimize the amount of people that are coming in for admissions based on poor control for an NCD or even getting an NCD, such as diabetes or high blood pressure. So we are very committed and trying to look at what they are working along with our stakeholders to push the NCD Commission as well and have the support from the cabinet level in terms of looking at it. Right now, I think the big focus, even globally, is NCDs and addressing NCDs. So it's really the new buzzword in terms of looking at what we can do as a country, as a region, in terms of addressing NCDs. So even by force, we're actually being placed to give this main attention, to give this a lot of focus. So we are committed, and we do have the support of our international partners such as PAHO, also with INCAP. NCDs has become a very big buzzword, and we are very committed in terms of addressing it from a national standpoint for Belize.
Something very important, apart from what Robin said, is that in the case of PAHO and INCAP, the Institute for Nutrition of Central America and Panama, priority has been placed in addressing risk factors and creating enabling environments that will allow for these changes. Because if the environment is not there, it won't happen.
Yeah.
The political will is part of it. The existence of the revision of policies is also part of that. So that's a priority. So countries, PAHO and INCAP will be providing support in advocating, in facilitating discussions, national discussions, to see what is in there in regards to policy that can be strengthened, to see what are gaps that need to be addressed. And something extremely important is that partnership between Ministry of Agriculture, Education, and Health. That's also a focus. It has been working, but I believe there's still a long road to go in strengthening that, so that the three ministries look at the same thing and recognize the rationale for such efforts.
Let me ask an update. I remember when Robin, you spoke about being able to work with food handlers and people who sell food to the public locally about about preparing it in a healthier way and keeping it within portion sizes. Has there been any follow-up to see whether they continue this practice, or if it's taken on its own momentum?
There has been follow-up, not nationally, but in some districts.
Yes.
There have been some improvements, I will say. Not the level of improvement that we would want, because many times people, vendors would say, we want to follow your recommendations, but our customers
get mad.
Yes, they want an extra amount of rice, they want some more gravy, they want that extra plantain, they want the fat, so I am saying that it's something that we need to work on. It's a struggle, it's a challenge. But I also tell people that, you need to have the option. I mean, if there is no extra pigtail in the beans, then we won't be asking for the extra pigtail if it's not there, if it's in very small pieces. So we have to make sure that, as vendors, we continue working along with them it's going to be an ongoing work in progress to continue, because behavior change takes a lot of time. Then looking at our habits, our culture, what we like, what we're used to, those things take a lot of adjusting, and we want to get people consciously making that effort without their arm having to be pulled in terms of eating healthy. So
we are to stop asking for the extra rice.
Yes. We want to see more people practicing that, and I think we are getting down that road. We're actually seeing people coming up with more healthy options. You're seeing more whole wheat around, you're seeing a little bit more grilled food available, things like that. But we do still have that challenge where we have a lot of fast food, a lot of fatty foods, things like that still available. So it will take more working together to get that objective done.
We've spoken and we're getting ready to wrap, but before we do, one of the questions I want to ask is, what has been the advocacy in terms of creating or encouraging businesses to go into wellness programs? Because that has been proven to be an effective way as well to engage employees and make it a part of what happens at a particular organization.
More focus needs to be done in that regard. We do see a lot of support happening around a certain time frame, like when we have Wellness Week, when we would have maybe around summertime or around heading into Easter, but we need to see it more throughout the year, more continuous, and that's where it has to be, again, something that we continue to encourage, because most of the times we would see workout programs or wellness programs just for a period, just for a season, and we do see a lot of companies taking it on, looking at the healthy eating approach, looking at having their staff do wellness activities together as a group. Even some of our activities that we have at the Ministry of Health countrywide, we do encourage our staff. We have wellness programs within our facilities, and we encourage and we invite other business partners to join our programs as well. But it needs to be done more on a continuous basis, and not only during a 1 month period or for a set time frame or right after Christmas or something. We need to make it be something more continuously done. But we do need to have more wellness programs being displayed. It should actually be a part of every single business organization in reality, taking care of your employees and encouraging that healthy lifestyle. But we still have some ways to go in terms of doing that promotion, but we're on the right track.
Recently there was an observation done here in Belize, whereby this building had 5 floors, and the observation was to see who used the elevator and who would use the stairs. And very interesting is that 100% of the persons who were on the 2nd floor used the stairs. It decreased to about 30% those who were in the 3rd floor, the fourth floor and fifth floor, zero. Which was a good opportunity, or is a good opportunity to use this to do your, to increase your heartbeat.
Is that the building you work in? And we'll ask you whether you take the elevator or the, no, Dr. Polanco, we know you usually participate in wellness programs and try to set the example, right?
I didn't see where it is. I just said
I am taking a guess at this moment, but you don't have to confirm.
So, no, but that's the interesting finding, that it's an opportunity to do exercise, to burn calories, going up 5 stairs 2 or 3 times per day versus using the elevator. So this goes back with what Robin was saying, that culture. So there is a need to continue sensitizing. And I believe if we keep the pressure, people will get the message and say, yeah, I need to climb the stairs. I need to avoid the sugary drink and drink water. And something I have also observed in Belize City, that traditionally when you would get rice and meat, the only option was potato salad. Now you have the vegetable salad there, and they would ask you potato salad or vegetable. So then the clients have the option. But if that option is not there, they won't even ask. So they would only get what is there.
Absolutely, I think it's a shared. Without a doubt, is a shared responsibility. If you can work with vendors or work with producers or work with the private sector, that is excellent. But also, we have to take it into consideration as well, the choices we make. I want to just close off. I know you have your forum being held today, and you'll be covering quite a number of issues. A lot of them we've discussed this morning. But if you were to tie down the message to, let's say, 2 or 3 things that Belizeans can be able to take into consideration so that we can prevent developing this condition, and if you do have the condition, that you maintain it, what would you say to them?
What I would say to them is that you could prevent diabetes. It's preventable. And the way to prevent it is by doing a radical turn in what Belizeans eat. That is, that, and secondly, on increasing the physical activity, because the physical inactivity is high in Belize and in the region. And when we say healthy food, we are literally referring to an increase in fruits, an increase in vegetables, an increase in pure water, which the other side to that means a decrease
in the other stuff,
in the other drinks, which are loaded with sugar, and that's a global buzzword right now, sugary drinks or drinks with added sugar.
Robin?
I think Doc mentioned the 3 points, but just to reiterate, it would be having a healthy diet, trying to increase physical activity, and also having positive lifestyle factors, which would be reducing smoking and, of course, alcoholic consumption, because those do have a negative impact on the body. So looking at, and when we say healthy diet, I normally emphasize 3 points: reducing sugar, fats, and salt. Once we look at those 3 points, you would be looking at some basic tips that you can start having to improving your diet and having a healthier lifestyle.
All right.
Well, thank you both for joining us this morning, and best of luck with your forum today.
Thank you.
We're going to go ahead and take a break, and when we come back, we'll be joined by representatives from BTL. Don't go anywhere. Open Your Eyes continues after these messages.